guys, it is June the 18th, 2024. And today I want to talk about the difference between belly fat and ascites. I have spoken about this so many times in this channel, but ascites has got to be by far one of the worst parts of having liver disease. It is horrible. And for any of you guys out there who have suffered, are suffering, have dealt with ascites, I'm so sorry that you've had to deal with that. I know how bad it is. It's completely horrible. It's uncomfortable. It's embarrassing. More than anything, it's just so uncomfortable. It puts so much pressure on your stomach. It puts pressure on your lungs. It makes it really hard to breathe. It makes it hard to eat. Very hard to eat. Anytime that you eat anything, you just feel like you just went through a buffet and had like 10 plates of food. And it could be like a half of a sandwich or something that you had. And it just completely fills you up and just makes you feel like you're totally bloated. It puts a lot of strain on your lower back because you have so much weight on your belly. So it causes a lot of back pain. It makes it almost impossible to sleep because the only position that you can really lay on is your back. There's just a lot of things that come along with it, but that's not what I'm here to talk about today. What I'm here to talk about today is the difference between belly fat and ascites. And for the quick and easy answer to that is that belly fat a lot of times will end up on the outside of our abdomen muscles. So you'll get like like flabby skin on the outside of your stomach. You can get visceral fat, that's around your organs and will push on your abdominal wall just like the ascites will. But you can get what's called soft belly, and I've got some information here to go over, but for the most part, like I said, if you're getting like a protruding belly and it's super hard, and if you can tap on it and it sounds really hollow in there, because that's what the doctor's going to do. He's going to take like 2 fingers and kind of tap across your stomach and listen to see if there's like a echo, because it sounds hollow, and all that water gets behind the abdominal wall and pushes out, which makes your belly really big. But then on top of it, you've just got fluid back there behind the abdominal wall, so if you tap on it, you'll hear like a hollow sound inside of there. Getting ascites can cause hernias. It's just, like I said, it's just horrible. And I'm about to go into this information now and just talk about this. But like I said, for the most part, if you can like grab your belly and kind of jiggle it around, it's probably not ascites. Ascites, I mean, your belly pokes out like you're 9 months pregnant. It's super hard. And you can't really like jiggle it around. Now you can. Now if you like lay down in the bed, it will kind of like, move around a little bit, but it's just not the same as belly fat. Not to mention, the difference between belly fat and ascites is that belly fat tends to take time gradually to get it. Ascites comes on pretty rapidly. I remember one time I came home from the hospital from having surgery. I had no ascites before I came home. 1 week later, I had water retention on my belly, and within a week my stomach was completely full of fluid. It does not take that long at all for it to fill up. So here's what I have here. What are the definitions of ascites and beer belly? The definition of ascites is an abnormal accumulation of fluid in the space between the organs in the belly and the wall of the belly. In the US, the most common cause of ascites is cirrhosis of the liver. The definition of a beer belly is simply a large protruding belly. It is also called a pot belly, a spare tire, or referred to as an apple shape. A beer belly is an accumulation of a large amount of visceral fat, the fat that surrounds your abdominal organs. Visceral fat pushes your abdomen outwards as it builds up, but because it is underneath the muscle, the belly feels hard. This is in contrast to subcutaneous fat, which is located just under the skin surface and results in a soft belly. So that explains the difference between a soft belly and having like a hard visceral fat belly. What are the main differences between ascites and beer belly? Both ascites and beer belly result in a large, protruding, hard belly and can resemble that of a pregnant woman's belly. Ascites often results in a rapid weight gain, in contrast to a more gradual gain with a beer belly development. Some patients with ascites may develop spontaneous bacterial peritonitis, hernias, like I was saying, fluid in the chest. Tests like ultrasound, CT, or paracentesis tests and or treatment for ascites fluid or fluid removal usually diagnose ascites, in contrast to a clinical diagnosis of belly fat that does not produce detectable abdominal fluid. However, the causes of a large belly are different for ascites and beer belly are presented below. So, what are the main differences in the symptoms and signs of ascites versus beer belly? Symptoms of ascites that are different from beer belly include belly pain, which I can definitely agree with. It causes a lot of belly pain. Difficulty breathing, absolutely. I had the worst time breathing during that period of time. And a feeling of fullness after eating only a small amount of food, just like I was saying. I would drink half a protein shake and feel like I couldn't finish it. I mean, I just felt so full. It would take me an hour to finish one protein shake. If fluid in the belly becomes infected, symptoms may include worsened belly pain, fever, confusion, and low blood pressure. I had infection in that ascites fluid once when I was in the hospital as well, and it was not a fun time. If you have been diagnosed with ascites and have these symptoms, see your doctor immediately. What are the main similarities between symptoms and signs of ascites and beer belly? Ascites and beer belly appear similar outwardly. Symptoms and signs of ascites and beer belly that are similar include a large distended belly, abdominal bloating, hard belly, and weight gain. What causes ascites versus beer belly? The most common cause of ascites is cirrhosis of the liver, which is responsible for about 80% of cases. Other conditions that can cause excess abdominal fluid buildup include the following: portal hypertension, which is increased pressure to the blood flow of the liver, salt and water retention, congestive heart failure, advanced kidney failure, certain cancers such as colon cancer, pancreatic cancer, breast cancer, stomach cancer, lung cancer, ovarian cancer, or lymphoma, urologic injury, rare causes, pregnancy, Whipple disease, and saccharosis, sacchardiosis. Beer belly isn't generally caused by drinking too much beer, but rather taking in too many calories. That said, a standard 12-ounce beer contains about 150 calories, so drinking a lot of beer can contribute to weight gain and a beer belly. Causes of beer belly include consuming excess calories and a sedentary lifestyle. And males are more likely to develop beer belly because men tend to gain weight in their midsection, while females tend to gain weight in their hips, thighs, and buttocks. Does beer cause ascites? Drinking beer and or liquor doesn't directly cause ascites, but excess consumption of beer may lead to ascites for the following reasons. The most common cause of ascites is cirrhosis of the liver. So, of course, drinking too much causes cirrhosis, which causes ascites. The most common cause of cirrhosis is alcoholic liver disease. Alcoholic liver disease can result from alcohol abuse, but it does not always, you do not always have to get cirrhosis from drinking alcohol, just to clarify that. Thus, excess consumption of beer may lead to ascites. What procedure and test diagnose ascites versus beer belly? To diagnose ascites, tests to detect fluid in the belly include the following: ultrasound, CT scan, paracentesis, and that is a medical professional inserts a needle into the belly to remove a sample of fluid and then sends it to a lab. This can help diagnose the cause of the fluid buildup if the fluid is infected. And beer belly in itself is not a medical condition, but abdominal obesity increases the risk of certain conditions such as heart attack, stroke, diabetes, and erectile dysfunction. For men, a waist circumference of 40 inches or greater, and for women, a waist measurement above 35 inches increases the risk of health problems. And like I was saying yesterday, I used to wear like a size 42. So I was definitely at risk, and I ended up getting a lot of problems. What are the treatment guidelines for ascites versus beer belly? Treatment for ascites depends on the cause and severity. If cirrhosis is the cause of ascites, treatment may include the following: avoiding alcohol consumption, low salt diet, which I've talked about, you need to consume no more than 1,000 milligrams of salt a day, taking a diuretic or Lasix, avoiding non-steroidal anti-inflammatory drugs, NSAIDs that can harm the liver, such as aspirin, ibuprofen, Motrin, and naproxen or Aleve. Monitoring your weight daily. If symptoms of ascites are severe, treatment may include the following: drain fluid using paracentesis. A doctor may implant a transjugular, intrahepatic, portosystematic shunt, which is the tips, which I have, in the liver to reduce fluid buildup, or a liver transplant and the liver disease is severe. Treatment for beer belly involves weight loss, and this involves good old-fashioned diet and exercise. Are ascites or beer belly serious? The prognosis for ascites depends on the cause and severity. If ascites is due to heart failure, patients may live for many years if treated promptly and managed appropriately. However, ascites due to cirrhosis usually indicates advanced liver disease, and the outlook is not good. If a patient has malignant ascites in patients with cancer, the prognosis is poor, and the mean survival time is between 20 to 58 weeks. Beer belly in itself is not deadly. However, it can increase the risk of serious illnesses that can be deadly, such as diabetes, heart attack, and stroke. How do you prevent ascites versus beer belly? Preventing ascites involves preventing the conditions and risk factors that can lead to fluid buildup in the abdomen. Avoiding alcohol or reducing alcohol intake may prevent cirrhosis, the main cause of ascites. Patients with existing liver disease should also avoid non-steroidal anti-inflammatory drugs or NSAIDs that can harm the liver, so ibuprofen and all that kind of stuff. Follow a low-salt diet as advised by your doctor or nutritionist. Take diuretics, water pills as advised by your doctor. It's possible to prevent a beer belly by following a healthy diet and exercising regularly to keep your weight. And then it's got a whole list of like foods that are horrible for your belly and all that kind of stuff. But the main point to this is that, you know, in order to avoid ascites, you know, is to stop drinking. You know, it's because majority of ascites is caused by alcoholic liver disease, cirrhosis. And I can promise you that you do not want to end up with ascites. It is by far the worst part. I've talked about it so many times, but it is just so uncomfortable. You can't lay on your side when you're in your bed because, and that's another difference too with having the ascites versus the beer belly. Because I used to have a big belly, and I could lay on my side. But when you lay on your side and you have ascites, all that fluid pulls over to the side, and you can't do it. It will take your breath away. It pulls so hard that it'll pull on your back because it's pulling on that skin. I developed hernias because of the ascites, because I got fluid on my belly so fast and rapidly that it just burst the abdominal wall. So that, like I said, just laying on your side. If you can't lay on your side, I would definitely go speak to a doctor if you have, you know, a really big belly. But if you, like, you know, in a 3-week period of time, your belly just grew really big, you probably have ascites. I would seriously doubt that you have a huge belly. Now, you know, I'm not a doctor or anything like that associated with the healthcare professionals, so I'm just giving you my experience with this. So don't take what I'm saying is, you know, the gospel or anything. I'm just saying that from my experience, if you try to lay on your side and you can't do it, if it's been a 3-week period or 2-week period and all of a sudden your belly has grown by 3 times, when you go to tap on your belly and it's super hard, but it sounds really hollow in there, you can hear the water sloshing around inside your belly too. If you go, like, you know, grab your belly and just kind of shake it around, you can hear the fluid in there moving around. If you go to lay in a bathtub, your belly will like float in the water, and it's just different than having belly fat. Your belly fat will kind of do the same a little bit, but not the same as ascites. Like, another thing too, like when I started to get the fluid on my belly, before the fluid happened, I could lay in my bathtub, and if I laid down flat in my bathtub, my stomach was under the water by probably that much. After the ascites started to build up, I could lay in the bathtub, because I spent a lot of time in the bathtub because it hurt my back so bad, and my stomach hurt so bad from the ascites as well. My belly started to protrude above the water, about like that. It was really simple to see that I had ascites. Not to mention I was skinny all over my body, and I have this huge distended belly. So if you're not picking up weight anywhere else, you know, your arms are still skinny, your legs are still super skinny, and all of a sudden you've gained all this, you know, mass in your belly area over a short period of time, that's probably ascites. And you know, if you've been drinking for a long period of time, and you start building a bunch of fluid up in your belly, you definitely need to go speak to a doctor about that, because there are things that they could do to help you. Like I was talking about, they can do a paracentesis. That's where they take a needle, they go in there, they can drain that fluid off. But they need to find out the root cause of the ascites, because there are multiple factors that could lead to the ascites. It's not just cirrhosis of the liver. You could have portal hypertension. There are things they could do to help address that. Chronic pancreatitis can cause it as well, and I thought that was on that list. I might have skipped over it, but chronic pancreatitis can cause it. I've gotten ascites from pancreatitis before. Pancreatitis can cause it. There's a lot of factors that can cause, like it's talking about heart failure, kidney failure, cancers can cause it. So just, if you're having ascites, it's just not going to be liver disease all the time. It could be something else, and you need to speak with a doctor and find out what's going on, because there might be a root cause that they could address and fix that for you. You do not have to suffer through the ascites. And there are things that you can do. You can lower your salt intake. Drinking more protein or eating more protein can help reduce the ascites as well. I didn't mention that in there, but when you have liver disease, it does help. Exercising, not drinking too much fluid. If you know, only drinking 2 liters of fluid a day, you've got to limit your fluid intake while you have it. I mean, speak to your doctor about it. This is all the stuff that I was told, and it helped me out greatly. I was on diuretics. I was taking Lasix. Like I've talked about before over and over again, if you are on Lasix or diuretics, just make sure you're somewhere near a bathroom, because you're going to urinate a lot, and it's going to be like every 10 minutes you're going to have to urinate, especially if you've got all that fluid in your belly and your body's trying to expel it. You just need to make sure you're somewhere near a bathroom, and if you have somewhere you need to be that morning, they tell you to take it like in the morning and at night. But if you've got a doctor's appointment at 9 o'clock and you get up at 6 a.m., I would hold off on taking your diuretics or your Lasix. I mean, I'm just saying what I did. Hold off on taking it before you go to your doctor's appointment, because you're going to have to stop every 10 minutes to pee. On the way to the doctor's office, while you're at the doctor's office. Always, if I had a doctor's appointment that morning, I waited, and then I took it when I came home, just to avoid having to go to the bathroom so often, because it makes you go to the bathroom a lot. But it's pretty simple to tell the difference between belly fat. If you've had a beer belly your whole life, probably not ascites. But you can have ascites underneath that beer belly as well. So if you've had a beer belly, but your beer belly has grown twice its size in a matter of 3 weeks or a month, it might be a problem. And there's simple ways they can go and they can check that out. They can do a quick CT scan, ultrasound. They can look in there. They can see if there's fluid in there. And that fluid can get infected. You do not want to end up like that. It will make you very, very violently ill. And you just don't want to deal with that. So if you think that you might have ascites, please go see a doctor. And I know that people say sometimes when I say that, you know, I can't afford it and this and that. And I get that. I do. But it's your life. And how much is your life worth? Because you can't really put a dollar amount on that. You know, wanting to be here for a little bit longer. There are things they can do for you, and the TIPS procedure helped me so much. And if it's something that you've been dealing with, I kept getting ascites, and it kept coming back. When they finally did the TIPS procedure, the ascites, I had it briefly after the last TIPS, and then it's gone away, and I haven't had, knock on wood, I haven't had ascites since. I know it's going to come back one day, but it's helped me so much over this period of time. So there are things they can do. And like I said, they can give you diuretics and give you Lasix. They can, you know, they can talk to you about your diet and all that good stuff. So if you think you do, don't put it off. Don't be like me. I put everything off in life, and I really suffered the consequences because I was scared to go to the doctor. I know it's not something that's comfortable to do. I know it's scary, but it's your life. You've got family, you got friends who love you. Please go take care of it and see what they might be able to do for you. But with that said, guys, I'm gonna go ahead and hop off of here today. I really appreciate everybody watching today's video, and I love you guys so much, and I will see y'all in tomorrow's video. Y'all have a great day. Bye-bye.